Sudanese American Medical Association, SAMA, are very proud of our collaboration with the International Society of Nephrology to support renal education in Sudan. We are very committed to renal education and our colleagues in the Sudan. In fact, this conference is our fourth activity, which is endorsed by the ISN over the past 12 months. We are also very pleased with our partnership with the Sudanese Nephrology Society, Sadagaat, and ISPD. This is really teamwork in action. See how many logos are there? Teamwork works. This conference takes place in the context of the ISN Global 0 by 25 initiative. I will let Fred talk to you about the initiative. However, I just wanted to share with you the title of this Lancet article that they have published, Fred and his colleagues, which I found really powerful. 0 preventable deaths by 2025, a human rights case for nephrology. I think, recognizing and treating somebody with AKI to prevent death is really a human right issue, no matter where the patient is from or what is his background.
Divided by the urine creatinine, plasma creatinine, and it simplifies to this.
I'm over here participating in the first International Dialysis Conference in East Africa. I'm in Khartoum. I guess I would make 2 comments about my experience here. Number 1, I can honestly tell you that when I told my family and friends back in the United States that I was coming to Khartoum, they looked at me a little bit cross-eyed. They wondered if I was crazy, if I had taken leave of my senses to go to someplace so unstable and so potentially dangerous. So let me address that. I can honestly tell you that I feel safer here than I do on the streets of New York. There has been not a shred of any instability, of any violence, of anything remotely suggesting terrorism. I could not feel any safer, and I can't overemphasize that. The second thing I would say relates to the level at which medicine is being practiced here. I can only speak to nephrology, that's what I see, but I can tell you honestly that the medicine here is being practiced at rather a high level, and I would suggest to those of you who are Sudanese or anyone who might be able to contribute to come over here, be it temporarily or permanently in case of some of you perhaps Sudanese physicians who have left, and you will be really very pleasantly surprised and be able to contribute to the effort that is going on here and to even further raise the level at which medicine is being practiced.
The further you got from Khartoum, the less the number of referrals to the hospital. So the number of patients with AKI in the more rural areas was presumably the same as it would be in Khartoum, but the referrals are less because of that distance. So how you solve that problem is a challenge.
It's a pleasure for me to be at the first International Dialysis Conference in Khartoum, Sudan, and to participate in this wonderful meeting. It's actually my second visit to Khartoum, I was here in 2007 during the African nephrology meetings. The meeting is really very well attended and is at a very high medical quality, and it's wonderful to have the chance to participate with physicians from the Sudan so that we can exchange information and participate in the conference with these physicians. Khartoum is a wonderful city. Our hosts have been absolutely terrific, and it's been great to have the interaction with the physicians here. We would hope to use some of the sites in Khartoum as training centers for other sites that we develop, providing dialysis services for patients with acute kidney injury in other parts of Africa. The level of care in Khartoum is really far above many other sites in Africa, and I think this could be a wonderful training site. And the city is wonderful, and the people here have been just wonderful to us. Thank you.
It's actually no surprise what they found, but it's very nice to see it in a graph. I've been attending the meeting here, the dialysis meeting in Khartoum, having been with the ISN in West Africa and then Ethiopia. It has been a fantastic meeting, well attended, over 100 people, and lots of questions. I have learned a lot about the quality and amount of dialysis in Sudan, and have had a wonderful time here in Khartoum. People are so friendly and welcoming. There are many trainees here whom I have seen in the UK who are now working back in Sudan or are planning to come back to Sudan, and I have met them previously and got plenty of patients also from Sudan. So I've really enjoyed my time here. The meeting has covered lots of different aspects of dialysis, and it will hopefully benefit patients here on dialysis in Sudan, as well as informing the international community about the developments that have occurred.
Today is the second day of the first Dialysis International Conference that we are organizing along with the Sudan Nephrology Society. This conference is taking place in the context of the 0 by 25 global initiative of the International Society of Nephrology. This initiative is aiming towards reducing mortality and deaths from acute kidney injury. The ISN, the International Society of Nephrology, is promoting global activities around the world in order to promote the concept of this global initiative. We in SAMA are very pleased to help the ISN bring these esteemed professors to the Sudan in order to educate people and exchange knowledge and expertise with people in the Sudan. We're very proud of our collaboration with the International Society of Nephrology. In fact, this is our fourth activity that is endorsed by the International Society of Nephrology within the past 12 months to support renal education and renal trainees in the Sudan. We're very proud of our partnership with Sadagaat charity organization and the Sudanese Nephrology Society in order to keep doing these conferences. Today is a very exciting day. There was a lot of enthusiastic discussions, particularly from the renal group from Soba University Hospital, Noura Center for Kidney Diseases in Children, who have discussed and shown their experience, which was pretty interesting and pretty encouraging.
I'm very glad this week we have, in collaboration with Sudan American Medical Association and the International Society of Nephrology, we have a meeting about renal replacement therapy, and this topic is really needed. It's quite important. We have more than 6,000 patients on renal replacement therapy in Sudan, distributed around more than 54 centers around different states. And many of them, when the time they need transplant, they have major complication of the end-stage renal disease, like advanced cardiovascular disease and mineral bone disease, which make them sometimes difficult to transplant them. So bringing experts from the International Society of Nephrology to the place here and delivering lectures in this area will improve the quality of service delivered to the patients, and hopefully will make some changes in the patients and will reflect on the outcome. I'm very glad, and I would like just to thank all people who share and who help and participate in coming here, especially to the Sudanese American Association or Medical Association, taking most of the work in this field. I would really appreciate all the work done, and thank you very much.